Hello and welcome to the Combination Prevention modules of the Healthcare Service Delivery chapter of the MSM Implementation Toolkit, or MSMIT, a tool that offers practical guidance for implementing comprehensive HIV and STI programs for gay, bisexual and other men who have sex with men. This training is brought to you by MSMGF, the Global Forum on Men Who Have Sex with Men and HIV. This module introduces sexual and other risk history taking, which is one among the 7 HIV combination prevention approaches presented in this module. It is listed with the other approaches here for your reference. In safe settings, an assessment of sexual history and other risk history, such as drug use, is necessary to inform risk minimization counseling as well as behavior change communication. This is also one of the first encounters providers have with clients, and it is important that it be done properly because it has the potential to positively influence clients to return and continue seeking services. MSM often fear the disclosure of their sexual orientation will result in stigma, discrimination, or criminalization, particularly in contexts where same-sex sexual activity or HIV non-disclosure are criminalized. It is the provider's job to help MSM clients feel safe. Presented here is a list of guiding principles that help create an environment in which MSM can comfortably disclose the details of their sexual behaviors or use of drugs and other risk history. Sexual and risk history taking should take place only once during a clinical visit and after rapport has been established with the client and an explanation given about why the sexual history is required. Occur in a private room with a trained provider or a self-completed questionnaire. Be conducted by a male service provider if this is the preference of the patient. Provide an explanation of why the information is required and how confidentiality will be maintained. Move from neutral to more specific questions and offer sample response options. Inquire about a clinically relevant timeframe for risk behaviors. Approach sexual behaviors as a normal part of a healthy life, without expressing an assumption that the client is heterosexual, and allowing the client to indicate whether he has engaged in sexual activity with men, women or transgender people, and inquire about drug use during sex and sharing of injection equipment for drugs or hormones. When taking sexual or other risk history, it is essential that providers should use their judgment about what to record, particularly in hostile environments where information could jeopardize the rights and safety of clients. Reinforce that the information provided is confidential, and reassure the client that the provider is not there to pass moral judgment, but also emphasize that the client is not required to answer any questions they don't feel like answering. Once the history is taken, risk can be assessed. Depicted here is a range of sexual activities and how they correspond to risk for transmitting HIV and other STIs. This concludes the sexual and other risk history taking module. Be sure to go through the other HIV combination prevention approaches presented in this module.